Which
maybe
one?
Hi, in Spokane, Washington, it's Jethro.
Hey, Jethro.
What is everything you need to know about Vagina House? All right, catch you on the flip side. Bye.
There you go. Okay, Taste, go.
Yeah, I don't know.
Go what? All right.
Yeah, I mean, I really don't know.
So I can say a couple of things. You starting the timer?
Yeah, it's already started it. I've heard it's self-cleaning. I don't believe that.
I also heard that. I heard
Sure.
as long as nothing crazy's going on, leave it alone.
Yep, exactly
If it ain't
right.
broke, don't fix it.
And yeah, if it don't stank,
Yeah.
Don't put things in there other than things that
There's
need
got to be a
go
rhyme, but I don't know what it
I
is.
know. But yeah, douches and all that kind of stuff, unnecessary. What you don't want to do is have intercourse with your tampon in because you're on your period and push the tampon in, which is fine. That part's fine. But then forget that it's there and leave it there for 2 to 4 weeks and then go to your primary care saying that, oh, I've got this weird odor down there. And when you pull that thing out, it's gray and covered in, I can't even describe it, and sort of this grayish slime that is just unbelievable. And it's all anaerobic bacteria that love just growing on there. And it puts you at risk for toxic shock too. So please don't do that. Ladies, if you're going to have intercourse on your period, I mean, who doesn't like, ketchup on their French fries? I get it. That's totally fine, but remember to take it back out.
Right.
Please.
Right.
Okay, so that's one of the big ones. Now, if you have bacterial vaginosis, that's caused by a bacteria called Gardnerella. I've said this before. One of the bits of evidence that our Creator has a sense of humor is that the bacteria that makes the vagina healthy is the same bacteria that makes yogurt, lactobacillus.
Yep.
So there are people who will advocate putting plain yogurt in the vagina if it has bacterial vaginosis. That's the fishy odor with a clear discharge. If the discharge got any color to it, you got to go see your OBGYN. But if you've had this before and you know that's what it is, you can use yogurt to just repopulate the vagina with lactobacillus. Make sure it's cultured yogurt and it says live cultures on it. I have a funny feeling, and I'm not sure, that if you go to this chicken place that's very popular all over the country, and they have yogurt there, I can't imagine theirs actually has a live culture in it. So don't use that.
No.
It has strawberries in it too, so don't do that. Unless you're just, doing it for fun.
Chicken place.
Yes, the chicken place that sells yogurt that's extremely popular, that when you drive through, you have to wait, 20 minutes because they're just printing money in there because it's always packed. Yeah, well, I was just bullshitting at that point. Thank you. All right. We'll move on, though. Let's see. How about one on messed up surgery?
Oh.
Hey, Dr. Steve, this is Rob. You just
Hey.
replied to my email.
Of
Just
course.
wanted to chat and see if you wanted to discuss what happened to me, on your podcast or just personally or whatever.
Sure, well, tell us what it was.
My cirrhosis and then infection and then the wrong size implant put in me. So now I'm going to have a fourth surgery, which people are telling me not to because I risk getting another infection.
Well, okay, let's talk about that part. So this person, it sounds like an orthopedic implant.
Okay.
And it got infected, and they had to take it out, and they put the wrong size in. Post-op infections usually are not actionable. Putting the wrong thing in sometimes can be. So I'm going to let him deal with that. But if the infection is completely cleared, and that's very difficult to clear an infection in the bone, it can be done. The reason is they don't have good blood supply. They're bone. You look at a bone, there is blood in there, but it's very hard to get antibiotics into an area that's basically solid
Right.
and cut off from the blood supply on purpose. So it can take 6 to 12 weeks sometimes, but if they really feel like they got it under control, the risk of having another implant,
Infection,
Yeah, right. The risk of infection with having another implant is the same as the first one. So if it was 1 in 1,000, it'll be 1 in 1,000 the second time.
It may even be a little slightly less just because you had that, and they're going to be super duper cautious.
Right.
Possibly.
I completely agree with you. Yeah. Again, if you know you're at risk for something, you're less likely to have it happen to you. A good example, I was talking on El Horrible's show today about people who get colonoscopies every year. We have a friend who gets a colonoscopy every year because they have familial polyposis.
Okay.
And they were like, why would you get a colonoscopy every year? Well, because he's at extremely high risk of colon cancer.
Gotcha.
But he's at very low risk of dying from it because he gets his colonoscopy every year.
Right on.
You know, they're going to catch it. You know? Okay?
Yeah.
All right.
1 minute, 9 seconds left.
Okay. Well, talk to them. I think that if it is affecting your lifestyle, the risk of having it, as long as they've cleared the infection, is the same as anybody else. And it might be worth it.
And with the new surgical techniques, if we're talking about a total joint, let's just say that maybe that's what we're talking about.
Yeah.
There's new technologies, there's new ways to make these new caps. Like say if it's total knee or total hip, it might wind up being a whole lot better than last time.
Okay.
Maybe, yeah. The newer
Hope
surgeons
so.
are pretty
Good luck. Let us know how it goes.
Yep.
All right.
30 seconds. Yes.
Here we go.
Hey, Dr. Steve and crew.
Hey, man.
Long time, first time.
Hey, thanks.
I was listening to one of the shows recently, and you brought up that you are suffering or have suffered from polymyalgia rheumatica.
This is correct. So back in the day, I started having muscle pain. This is part of the question still, Taste. Don't start the thing yet.
No,
this is part. Now, fuck off. This is part of the question. I'm just explaining what he's talking about. I had proximal, in other words, pain close to the midline. So in my shoulders and in my hips, started just having muscle pain. And they checked my blood work and had an elevated enzyme level called CPK that's secreted when muscle cells die. And I had a mildly elevated erythrocyte sedimentation rate, which was indicative of inflammation in my body. Everything else completely normal. So the way that you test for this is you put the person on a very low dose steroid, like prednisone, 5 milligrams. If it goes away, then you've kind of made the diagnosis. So that's what that is. And I had that, and then I went off the prednisone after about 6 months, and I just wore it out, and it went away. Well, shit, it's come back. So this is one of those things that just sort of, for me, apparently is waxing and waning. The thing is, normally little old ladies get this. So I am an elderly woman and when it comes to my disease processes. But anyway, okay, so we're going to get back to the question.
And my father was recently diagnosed with that.
Okay.
And he's come a long way in terms of pain and having to deal with it. But I'm sure like any polymyalgia rheumatica sufferer, he has flare-ups from time to time.
Yep.
And he also has what Dan Patrick called a brain fog.
Okay.
And I just wanted to know how you deal with that on a day-to-day basis and kind of a better idea or a better understanding of how that works on the body and what someone can do for flare-ups.
Sure. Yeah. Okay. You ready? So I have some personal knowledge of this. I had a professor in medical school. He had an IQ of 220. I mean, it was the highest IQ of anybody I've ever heard of or seen, except for Marilyn Vos Savant. And when he got dementia and he couldn't name things anymore, he was still a genius. You know, because he went from 220 down to 160 or something. Right. So, you know, he called a deck of cards a concentric stack of thin laminates because he couldn't think of the word deck of cards. I mean, it's crazy. So, you know, for me, my brain fog, you know, I've got an IQ of 165. It takes me down to 130. I'm still pretty good. So, but what I've found helps the best for me is getting regular exercise, which I don't do enough, but I do try to walk, and I feel more alert and oriented and not sleeping too long, but getting enough sleep. And then, again, the lion's mane has helped me. Cordyceps helps. Always check if you're going to take a supplement, talk to your doctor and those things. And then when he has a flare-up of the myalgias, which just means pain in the muscle, he needs to get back on the low dose prednisone for a short period of time.
Well,
Go ahead.
but there are other options to steroids. I mean,
Well, I mean that's okay. In allopathic medicine,
Right.
the treatment that we use is prednisone. If everything else fails. So go ahead.
Well, I was going to say if everything else, but you don't want to continually have people on steroids if you don't have to. I mean, certainly
agree.
there are times for that, but
Hence the phrase for a short period of time.
But okay.
Go ahead. Go ahead.
So
It's fine.
turmeric or curcumin is another
Yep.
good, and it's been shown to work about as well as steroids do.
Okay.
As far as it's an anti-inflammatory, it works like an NSAID. It works.
It
a
is
lot,
an
yeah.
NSAID.
Well, but it works just like steroids
Yeah.
without a lot of the side effects as far as affecting blood sugars.
And it has good
Yep.
good results
It
in
does.
polymyalgiarheumatica.
And not only exercise, but sleep. Sleep hygiene is very important.
Yep.
And so if you're not getting sleep, that's going to give you a lot of aches and pains. And the other thing is just to remember, sometimes dietary changes. I mean, if you eat certain foods, they can cause inflammation.
Sure.
I mean, it can be anything from wheats to chicken to shrimp to whatever. So maybe they ate more chicken or more shrimp or something like that. Had a flare.
Anti-inflammatory
Yeah.
diet.
Yeah.
Do you ever recommend that?
Oh God, every day.
Well,
Yeah.
tell people what to take.
Yeah, anti-inflammatory diet. Just a lot of times you don't even know you're allergic to something until you stop eating it. So it winds up being an elimination diet. So if people with headaches, people with chronic pain syndromes, a lot of times we'll start taking them off of foods. And believe it or not, one of the main things I take people off of is chicken. Chicken has big protein molecules that cause a lot of arthritis in people.
I wonder if organic chicken would be different than...
No.
They don't think
no,
it's just chicken.
It's a protein molecule.
Tom.
Damn it. I was going to say, it's just like shrimp and purines.
Okay. Yeah.
Damn it.
Turmeric can cause acid reflux, and it acts as a blood thinner, too. So you
Yes,
got to
that
make
is true.
sure...
That is true.
I'm just going to say this, and this isn't part of the time. This is a general
You
warning.
are
Fuck
always
off.
saying this is not part of the time. Obviously, it is.
It can.
No, this is a general warning. Right. If you are on supplements, tell your doctor that you're on supplements.
Especially, and you don't want to take that before procedures, an
Correct.
epidural or surgery, something like that. Yeah.
And lots of other things, too.
Yes,
So
yes,
make
true.
sure that everybody knows. Okay, all right.